that I wouldn't hesitate to get the vaccine. But I also want to set an example.
Well, you heard him. The president-elect says he wouldn't hesitate to get a COVID-19 vaccine once one is ready and new at 11. We're getting closer to having a vaccine.
Today, Moderna announced its COVID-19 vaccine that's in trials right here in the Triangle is nearly 95% effective.
It really looked very, very well tolerated. We haven't had any problems here, but we're a small sample of 30,000 people, but certainly seemed well tolerated. But it was nice to see that in the data from across the study.
Pfizer already announced its vaccine is more than 90% effective. Both vaccines are awaiting FDA approval, but Dr. Aaron thinks there's a good potential we could see 2 vaccines being distributed at once. And while the news about the vaccine trial is exciting, the state's health director says we cannot let our guard down yet.
Yeah, Dr. Elizabeth Tilson says small amounts of a vaccine could be available at the end of this year, but it won't be widely available until spring of 2021. So we wanted to know where local hospitals and health departments stand with plans to start vaccinating people.
And will the people who need the vaccine first get it? And will they even want it? Tonight, only on CBS 17, our Maggie Newland is getting answers.
While drug makers race to develop and test potential COVID vaccines, health departments and hospitals are putting plans in place to distribute whatever vaccines get approved. But there won't be enough for everyone.
Supply is going to be controlled centrally by the federal government. They're going to distribute it to the states based on population size.
The state's 140-page plan lays out who will get the vaccine first in North Carolina. Priority 1A includes healthcare workers and first responders at high risk of exposure to COVID-19 and people needed for vaccine distribution. But who exactly meets those criteria?
There's a lot of logistic planning already underway to say, right, how many people do we have who fit those roles? It's not every healthcare worker.
Dr. Cameron Wolfe, an infectious disease expert at Duke, is helping create the hospital's COVID vaccination plan.
Part of what we're actually doing at the moment is to generate lists of saying, look, here are all the people who in their normal day-to-day job come in contact with COVID patients frequently. And then you sort of draw a bigger circle, as you will, like who are the extra people who either through serendipity run into someone who's COVID positive on the ward or in the clinic, or might be pulled in to help in the emergency room.
At the Wake County Health Department, stick figures and diagrams are part of a complex plan to distribute the first round of COVID-19 vaccines.
In Priority Group 1A, we've identified approximately 2,500 personnel. They are your frontline healthcare workers. They are people who are vital to our COVID-19 response.
That could include EMS crews, firefighters, and people who work at COVID testing sites, among others.
Do you have any idea if you will get enough doses to handle the number of people in those groups or in the first group?
Yeah, we have no indication at this time.
If the county doesn't get enough doses to cover everyone in the first group,
we do have plans in place for a priority group for our priority groups, if you will. And then that needs to be determined by our senior leadership and county manager's office.
But while there may not be enough shots to go around, Wake County Pharmacy Director Dr. Jason Wittes says we could see the opposite issue.
And my personal biggest fear, similar to Operation Warp Speed, is we have all these plans in place, we have the vaccine on the ground, and no one shows up.
And with the vaccine being developed as quickly as it is, do you have a concern that healthcare workers will not necessarily want it?
Sure, and I think that's something that we've really got to work hard towards helping them through that.
Are you personally, as a doctor, comfortable with as quickly as the trials are moving?
I am. I think that there's really a good amount of scientific rigor that is going on. I have spoken with a number of the FDA regulators myself. I've heard from them directly.
Although some hospitals and health departments do mandate flu shots for employees,
I don't think anyone is thinking that we are going down the path of mandating a vaccine.
Doctors say they expect data to drive decisions.
I would be first in line as long as the data proves that the vaccine is going to be safe and effective.
Along with personal experience.
My colleagues and I have seen so many patients in the last 9 months coming in with COVID, breathless, sort of sick, and in many instances passing away from this, that the recognition of one's own risk, if I'm sitting here working on a COVID unit, is pretty significant. And I think you'll see most healthcare workers who've in fact been dealing with COVID fully understand the risks that they're undertaking every day, and that will be their compelling reason to move forward and line up.
Maggie Newland, CBS 17 News.